Hello, my name is Andre Ganalzer, and I will be presenting atrial fibrillation. A-fib is a homeostatic imbalance caused by a deficit in the natural conduction system of the heart. It presents with rapid and chaotic beats of the atria from the SA node misfiring. It disrupts the normal heart's sinus rhythm, and on an EKG appears as there are multiple P waves. A-fib can have something called RVR. RVR stands for the rapid ventricular response. This is when the ventricles receive the misfire from the SA node as well, and begin to beat quickly with the atria. Other types of AFib are most classified as how long they last or what causes it. Paroxysmal is less than a week and caused by unusual activity, such as heavy drinking or heavy activity, which your body would be unused to. Persistent is greater than a week, caused by old age, hypertension, COPD, CHF, and etc. This can go away on its own. But long-standing persistent is greater than a year and does not go away on its own. Permanent or chronic AFib can be corrected by treatments which will be discussed later on. Valvular AFib is caused from an artificial heart valve or valve disease. Non-valvular is similar to persistent, but it's more chronic, caused by old age, hypertension, heart disease, alcohol, genetics, and sleep apnea. Dysrhythmias can also be caused by an electrolyte imbalance, such as too much potassium or sodium. AFib presents as a fast, irregular heartbeat. On a palpated pulse, you'll feel as if it's a regular beat for a few seconds, and then all of a sudden it'll skip to a much faster rate, anywhere from 100 to 175 beats per minute. This can last upwards of a minute, or as short as only a few seconds, until the heart goes back into a normal rate. During this period, symptoms can include shortness of breath, dizziness, weakness or fatigue, or chest pain, or like your heart is racing. The first method of treatment for AFib is medications, such as beta blockers that slow the heart rate, potassium and sodium blockers, and anticoagulants and blood thinners to prevent blood clots. When medications don't work, the heart may be shocked back into sinus rhythm called cardioversion. Pacemakers with defibrillators can be implanted into patients to shock the heart when it detects an abnormal rhythm. Lastly, a more invasive procedure consists of burning the part of the heart that causes the problem. This leaves scar tissue behind, which doesn't allow the signals to pass through in order to create excess beats. AFib can usually be treated and corrected with medical practice discussed in the previous slide. But if chronic AFib is not treated, it puts patient at extreme risk for a stroke. The fast-beating atria does not allow blood to escape, leading in a pool of blood which will eventually form a clot. This clot can be passed through the heart and vessels of the body and made to the brain, which will lead in a stroke. When treatment for AFib is unsuccessful, patients must remain on prescribed medications to control their heart rate and prevent clots. Thank you for watching my atrial fibrillation presentation.